So you recently posted a very controversial post about Botox. Now, tell me, how can Botox screw up your brain?
Our brain has a system of signaling neurons. We've got astrocytes that signal into microglial cells, which ultimately are, once your microglial cells are activated, your immune system of your brain is activated, the inflammation of your brain is activated, and that can go on into tau protein deposition, which is the hallmark of Alzheimer's.
What makes it so hard with allopathic medicine, people just want to come to you for a quick fix, and that's a huge cause of physician burnout, because it's we're just perpetuating these chronic diseases, and it's so freaking frustrating. But before we even get to prescribing that, we got to get these people in the gym. We got to get these people to eat right.
If they're on the GLP-1, they start implementing the lifestyle behaviors appropriately. They're going to hardwire those habits in. And I think that's a really cool opportunity if they take it. A lot of people don't take it, right? And then I won't write the prescription anymore. I'm like, no, sorry. You got to, I'm pretty hardcore. You got to do it my way or we're not doing this, because
Welcome back to Skin Deep MDs. Today we have the amazing Dr. Tyna Moore. She's a licensed naturopathic physician. She's a chiropractor and host of the Dr. Tyna Show.
Dr. Tyna Moore has over 30 years of experience in regenerative medicine and women's health. She's known for her no BS approach to metabolic healing, hormone optimization, and microdosing GLPs, not for weight loss, but for true resilience. She hosts the Dr. Tyna Show, and it is a leading voice on medical autonomy, strength, and healing from the inside out.
And this is a good episode, y'all. She does not hold back, and we love that. So in today's conversation, it's all about cutting through the noise and getting to the truth about your health. Whether you've heard the buzz around Ozempic or other GLP-1s, or you're just curious about how to actually feel good in your body again, this episode is packed with so much insight.
She is going to be answering our burning questions.
Yes, is Botox ruining our brain? Oh my God, that was a scary one.
And what the hell is peptide stacking? And should you be microdosing GLP-1s?
Yes, and can strength training actually save your life during menopause?
And is it really safe to be slathering vaginal estrogen all over your face? We're going to get into it and more. Welcome to the show, Dr. Tyna.
All right, Dr. Tyna Moore, thank you so much for coming on the show. We are so grateful to have you here.
Thank you. Thanks for having me. I'm excited to be here.
Okay,
Yes.
Dr. Tyna, I know, I just need to jump right in. There are so many hard-hitting, controversial issues that everyone needs to know about. Okay, so you recently posted a very controversial post about Botox. Now, tell me, how can Botox screw up your brain? In so many words.
So I will start with saying I have been an avid Botox user for many years. I'm 51 and I've been using it since I was 33. So I just want full disclosure there, Dysport and Botox both, and I've offered it in my clinic. This study scared the crap out of me. It basically showed that not only are we getting retrograde absorption into the brain from the delivery in the skin of the Botox, but that it's doing some pretty concerning things inside the brain. And so the way the brain works very quickly is our immune system in our brain is not like our body. Our body has a teeter-totter sort of balance, checks and balances system when it gets thrown off, and our brain not so much. Our brain has a system of signaling neurons. We've got astrocytes that signal into microglial cells, which ultimately are, once your microglial cells are activated, your immune system of your brain is activated, the inflammation of your brain is activated, and that can go on into tau protein deposition, which is the hallmark of Alzheimer's. And so that pathologic pathway that's occurring is incited by Botox. So now the study itself said, oh, don't get too concerned, because this was a 3D model of the brain. It wasn't necessarily in humans, but they did show uptake from the, subcutaneous and then intramuscular injection of it into the brain, activating the astrocytes, activating the microglial cells, and then activating tau protein deposition, which kind of scares the crap out of me and bums me out severely, because I don't know if I want to use it anymore.
Yeah. So is it scary enough to you that you are no longer going to be getting neurotoxins or Botox? And do you really think that it could lead to or trigger something like Alzheimer's?
necessarily want to jump to those conclusions, but I do think for someone like myself who has a variety of autoimmune conditions that maybe it's not the best thing. I also have some brain fog issues that I've dealt with over the years. So I was talking to my daughter about it, who she's in her 20s and she loves a little bit of Botox just right between the eyes. And we have studies too. You know, I've always supported Botox with studies showing really incredible impacts on those who are dealing with depression and anxiety, you know, because it's that muscle brain connection. If you inhibit the musculature that causes the emotions to trigger, you don't get the emotions to trigger. But then there's other data showing that maybe we lose our empathy and our apathy, you know, we become apathetic. And so I'm like, I don't know. I'm the jury's out. I haven't had any in my face for a year now. I think the most concerning actually is those who are using it. I got a lot of people drop into my DMs asking about, they're using it for migraines and they're using it intramuscularly in the neck muscles, and they're using really high doses for that. So that's right next to the brainstem. I'm like,
for sure.
I don't know. What do you guys think?
I think it's a tricky subject, and to play devil's advocate, you can also say, well, a little bit of Botox or a little bit of neuromodulators, when used appropriately, can really boost someone's self-esteem too, you know. But I can most definitely see your point of view where you use high doses of these neurotoxins for so long that you forget how to show expression, and that can not just change your personality, but it can change the way people treat you. So I definitely think that there's a fine line, right? Like, I am obviously an huge advocate as someone in the field of dermatology for neurotoxins, because I have personally seen how, like you said, just a little sprinkle of Botox can significantly improve and boost someone's self-esteem, especially in that population of women that are like 40s and 50s who don't have money to get a facelift, who don't want to do a facelift, who don't want to drastically change their appearance. They just want to age a little bit better. And if these, 11 lines are killing their self-esteem, a couple of units there can really boost their confidence. What do you think, Mamina?
Yeah, I mean, I thought it was interesting on your show when you were saying that it's kind of like similar to psychopaths, because psychopaths can't like move their foreheads, and it's like, yes, and they lack empathy. And so I could kind of see how, like theoretically that can play a role. I don't know of studies where there's lack of empathy. Did you say that there was a study where there's still lack of empathy? Because there are certainly studies where it does show that it helps with depression, because, like you said, there's this muscle brain connection where certain facial expressions can set off certain emotions, and we see that it does help with some of those negative emotions, depression, but I mean, I could see theoretically how it can also affect positive emotions too, especially like the smiling muscles.
There was a study showing that, well, it's the mirror neurons, right? People mirror our emotions through our expressions. And so they looked at, and I don't have the in-depth details of the study, but I included it in the show notes of that podcast episode I did, or I think I mentioned it. Something about, it's the muscle connection to the brain. So if the muscles can't fire to trigger the emotion, then the emotion isn't felt. And then the way that people respond to those who are heavily Botoxed because they're not showing any expression is really interesting. So, but I mean, it's just like this GLP-1 conversation we were talking about off camera. The train has left the station. I mean, we've got 20-year-olds freezing their faces completely. Like, it's just gotten to bizarro land. When I first started, it was, a little tiny bit to get rid of some heavy lines in the forehead in younger women, maybe in their late 30s. And then moving into their 40s and 50s is just a goal of like, how do we make them look as gently aging as possible? Whereas now with the Kardashians and this whole movement with filler, like, people look completely different with so many things they're putting in their face. So I think it's a matter of volume and use and how often. I mean, these women are doing it so often. Their faces are frozen from the time they're 20. And I mean, what are they going to do? Carry that through into their 60s?
And I have a couple concerns here. So one, I do agree with what you're saying, especially like I have two kids, right? And so when they're babies look at their mother's facial expressions to learn about their mother, to learn about the situation. And so if you can't make facial expressions, what your children are confused. Your babies are confused. So I am a huge advocate in allowing my neurotoxins to wear off. So obviously when I get it, it's going to look a bit more frozen because when it's more frozen, it lasts a little bit longer. So it's just more of a lazy girl convenience thing for me. But I typically let my neurotoxins wear off until they're completely gone, and my wrinkles are really starting to form again, that I go back to it. And that's what I tell my patients. I don't think that it's normal or appropriate to be completely frozen. And also the other issue is if you are constantly freezing your muscles, especially the frontalis muscle, over time, that's going to atrophy and it's going to look weird. It's going to look weird as hell. And you're going to have a really big forehead. And then my other
really shiny forehead.
Yes. And then the other issue, Mamina, is I see these people who only rely on neurotoxins to help with anti-aging, right? And they're not doing other things. They're not doing sunscreen. So then their face is looking hyperpigmented. There's tons of aging issues. And then they're not addressing their lower face, which is one of the biggest things that we see during perimenopause and menopause is sagging and jowls because of bone changes and fat loss. And so if you're just treating the upper face, the forehead, the frown lines, the smile lines, that's going to look really freaking weird when that's not moving and is shiny as hell and the lower face is sagging and dragging. So I obviously am a huge fan of neurotoxins, but it has to be done appropriately, and there's definitely a fine line. And I think, Dr. Tyna, you bring up something that's even more important, that how it could be affecting us internally.
Well, and then it's risk tolerance. Because I brought this study up at a recent dinner with two of my colleagues who are in their 30s. They're both doctors and they both love Botox. And I told them the details of this study and they were like, oh, who cares? Like they could give a shit. They were like 35 and they were and they were both super hot chicks and they're like, we're not thinking about this. So it's risk tolerance, but it's awareness. And as we gather information, I think it's good to have. I am never one to come out and judge anybody for doing anything to their body. Each person's medical journey and beauty journey is their own personal information. But I thought to share it at least because it did give me pause and it made me, I was just about to actually go back in and get my face redone. And I thought, I don't know. I don't know how I feel yet. The jury's out. I'll let you know, because I was talking to my daughter and she's like, Mom, can't we just use a little bit? Can't we just just a touch?
I really do like that you brought this topic up. And because I think that yeah, we're using Botox probably more than one needs to. I think that, yes, we know the benefits of Botox. Like it helps so much with confidence, but there's a way to do it in like a modest, like tasteful, way where it's you don't have to be excessive. You don't have to freeze your face. And so I think that studies like this, even though this is in vitro, we need way more studies before we can change guidelines and whatnot. But I think it's just good to get people thinking, okay, maybe I don't need to start right now, or maybe I don't need this much. Maybe I should try to look at other things for skin health, which you pointed out, Lindsey, it's so important. I've noticed that I've actually have been able to cut back on the amount of Botox that I use because of all the other things that I'm doing too.
Absolutely.
So it's like, yeah, let's try to focus on all the other things we can do to help our skin. And if we need Botox, yeah, use Botox. What I'm curious about is, Botox has been around since the 80s, and it was initially used for people with disorders. I believe it was with some ocular issues. And so I just am curious for the population who have been using it for that long, if there is a correlation. I don't know if they could do a well-designed study based on that, but if they could see a correlation with any health issues, whether it is, increased risk of Alzheimer's or other health ramifications, because it's, 40 years.
Right.
But yeah, so we need more studies, but I love, even though it's so controversial and could affect the livelihood of so many dermatologists, I still love that you brought up this topic.
Well, I didn't for a long time. The study's been out a while and I wasn't going to say anything. And then I was like, because my audience, they think that I'm some kind of purist, puritanical health fanatic. And I have never, ever, ever lied or tried not to disclose that I use Botox or that I might have had filler in my past, or that, I'm not. I mean, I prefer a natural route, but my goal with everything, all medications and procedures, less is more, right? And so the less amount of Botox we can use, just bringing awareness, because like you said, just like when we talk about GLP-1s, it's a comprehensive treatment plan, right? We're doing all the things, including strength training. We have studies showing that strength training improves collagen and improves facial structure. When we have good musculature and muscle tone body wide, we're going to have better facial structure. So, you know, women, I would get women in my clinic who wanted more and more and more and more Botox, but they didn't know the inside of a gym if it hit them in the head. And I'm like, your face is sagging because your whole body's sagging, lady.
Yeah.
You know, and you're not eating any protein, and you're not like none of it. So we can't just freeze you as you melt. So, like, that's not that's not good either.
Exactly. There's a topic I really want to jump into. Speaking of medication, something that is just as popular in the health and wellness industry right now, and that's GLP-1s. And there is something that you've talked about that I find absolutely fascinating. And so I think we all really need to know, what the hell is microdosing when it comes to GLP-1s? Break that down for us. Tell us what it is and how is different than traditional GLP-1s for people who may not follow you or know about microdosing.
Okay, I'll try to keep it tight. It's not a weight loss strategy, number one. It has been turned into this elitist vanity weight loss strategy all over the internet. That's what the telemedicine companies are promoting. That's what the Medi spas are promoting. That is not at all what I intended when I started having this conversation 2 years ago. My thought process with it was, we make GLP-1 endogenously in our body. We make it in our gut and we make it in our brain. So my initial thinking was, well, if we make it in our brain, it must be important in the brain. And I started looking into it, and it is not just for appetite suppression. There are mechanisms in the brain that help you with appetite control, and it can, at higher doses, cause appetite suppression. It also has an anti-inflammatory impact and a regenerative impact in the brain. And that was really intriguing. So my next dive into the literature was around pain and the musculoskeletal system, because we've all heard about the dreaded muscle loss. It turns out GLP-1s are actually really beneficial to muscle and bone. They are regenerative and protective to muscle and bone, and anti-inflammatory. It's the dosing that could be the potential problem, the dosing and management, right? And so I got to thinking, well, what if we utilized in people outside of weight loss, outside of type 2 diabetes, which is what it's FDA approved for, what if we considered little tiny doses as part of a peptide stack, as part of a bigger picture, more comprehensive treatment plan? The way that I treat my patients is, there's HRT, there's peptides, there's lifestyle, of course, there's strength training, like the whole kit and caboodle. There's gut health, there's thyroid and adrenal health, right? Like, all of those things are addressed. And I thought, what if we utilized little tiny, I'm talking a fifth to a tenth of the standard starting dose of a GLP-1 for longevity purposes, for anti-inflammation purposes, for autoimmune disease, not prevention, treatment, or cure of anything, but just simply optimizing the system. That's what I do as a naturopathic doctor. It got twisted along the way, and it's been written up in big publications, and it is now being touted as a weight loss strategy. And in fact, the grosser part is, they're not even using microdoses. They're using the standard starting dose, and they're just keeping the dosage low, and they're calling it and advertising it as microdosing.
Oh my God. That sounds like not only dangerous, but illegal. Like, that doesn't seem right.
It's super scammy.
Yeah.
I have had no less than 5 people in the last 2 days come to me and say, so I signed up with this telemedicine company. They advertise microdosing GLP-1s. That's why I signed up. I got my bottle. Here's my dose. Is this a microdose? And they give me the strength, and they give me the units that they're supposed to pull up. And I'm like, no, that's the standard starting dose, which in some of these folks who are already very lean and have really great muscle mass, who are really looking at it to maybe, because we've got studies showing GLP-1 actually sit on the immune cells and stabilize mast cells. So something like mast cell activation syndrome, this could be a potential helpful agent for, again, not preventing, treating, or curing it, but just adjunctively to help kind of keep the immune system chilling. But no, it was the standard starting dose. And I'm like, that would end you up in the ER. Like, that's way, way, way too high a dose for that individual. So all of them were advertised microdosing and given standard starting dose. And that's what a lot of doctors out there who are coming at me saying, we've been doing this forever. I'm like, no, actually, you're using the standard starting dose. That's not a microdose.
Yeah. So what would you suggest if someone was interested in microdosing? Who would be the perfect candidate for it? How would they go about getting it? And what kind of results should they expect? And how should it be paired? Like, what should it be paired with?
Yeah, good question. So you're going to have to give me a chance and ask me each one again so I don't forget any.
If I can remember what I just asked you. Okay.
Okay, who is it best for? I think it's
who's the candidate?
I really couldn't put a label on that. I think you optimally are going to get the best results in those who are already metabolically optimized. So those who are already taking really good care of themselves, who have good muscle mass, who go to the gym, who do the walks, who do the circadian balancing, you know, they go out in the daylight, they go to sleep at night, they sleep well, they have their HRT on board, you know, they've taken care of the other issues in their life, because GLP-1s can really magnify hormonal imbalances. I found if you have a low-key hypothyroidism, your hair will start falling out. If
on a GLP-1.
Even with a microdose. So you have to address the other factors, but you can add this in adjunctively. And so I'll give you some case examples. Middle-aged man whose both of his parents have had cardiovascular events. One of his parents has passed away. I'm using it preventatively at a very low dose for him to help him and we've gotten it has improved his blood pressure, and it has improved his metabolic markers. He was like low-key metabolic syndrome, just barely, you know. Beautiful improvements there. For myself, I use it for neurocognitive benefits. I was dealing with a lot of foggy brain after COVID. I've got psoriatic arthritis, so I deal with a lot of pain and inflammation. It's been shown to have impacts there. So I use it there. I cycle it. I stay on a very low dose and I cycle it. I do not dose myself into appetite suppression at all. That's not the goal of microdosing. We might use it. My mom is a great example. She's in her 70s. She's dealt with chronic polyarthralgia throughout her body because of Crohn's disease that she's had her whole life. We've got her Crohn's under control, but we add in just the tiniest little bit of GLP-1 and all of her joint pain goes away. So there's a myriad of uses here. So who is it best for? Hard to say. If you have weight to lose, if you have moderate to substantial weight to lose, you're looking at standard dosing. Microdosing is not going to be the thing. And if you eat a shitty diet and you live, you know, a really inflammatory lifestyle, a microdose isn't going to do much for you. So this really is for those who are kind of on the path already of good health and have their lifestyle dialed in. I think that, give me the rest of the questions if we can remember them.
Well, I also just did want to comment on that, though. It's like what my gym instructors tell me is you can't work out a shitty diet, right? So you can't just fix all your problems with Ozempic, with GLP-1s. Like, it is meant to be one piece of the puzzle into becoming the best version of yourself. And I want to dive a little bit deeper into what you consider, non-traditionally, as someone who's not who practices medicine differently than how we learned in an allopathic sense. Like, I want to know all of the secrets that you tell your patients and what else you incorporate microdosing in. Like, you talk about protein stacks and getting your hormones right. Like, I know this is going to be different for every patient. Like, it's going to be very unique and specific to their health. But what are some things that you consider into your patients and helping them live a healthy lifestyle that we don't consider in allopathic medicine?
So the foundations are core, and that's the work for the patient to do. That is not for the practitioner to do. We're just cheerleaders in this. Obviously, exercise. And I'm a big fan of muscle. I always have been. So strength training 2 to 3 times a week, maximum, especially if you're a female. We're not trying to, we're not doing bodybuilding competitions here or like CrossFit competitions. We're just trying to keep our bone
Unless
density.
you're Lindsey. Lindsey does CrossFit.
I do CrossFit.
Well,
so I'm selfishly tell me all the things so I can continue to live longer.
We don't want to overtrain, I guess is what I'm getting at, right? So train for what's appropriate. And my world is orthopedic faults. Like, I dealt with people I am a regenerative injection therapist. So I helped people with non-drug injection therapies like stem cells and PRP. And you don't have much to work with if the person doesn't have muscle mass. The joints are not going to regenerate themselves. There's not much to work with there. I just ask people this: if you cut your finger or you cut your skin or you get an abrasion, do you heal quickly? That will tell me all about your vitality and your overall health, right? So strength training a couple times a week. Don't overdo it don't overtrain yourself into hormonal disruption. Making sure that you are getting up with the sun and going to bed with the darkness. I'm not a big fan of swing shifts. I think that does terrible things to your body. So making sure that you are getting outside several times a day. Wear your sunscreen if you want, but I am a fan of sunlight. I'm not a big fan of roasting in midday sunlight. I'm a big fan of the red light and the infrared light that we're getting in the morning sun and in the afternoon, evening sun. Just getting light on your skin, right? Like a mammal. We're just fancy mammals with opposable thumbs, right? There's something too, though, that I think you guys will appreciate. I saw this on the MedCram doctor. He was on Huberman. I forget his name. He was talking about how greenery and nature actually reflects red light and infrared. So if you are out of the sun, but you're in greenery, you're going to be getting a lot of those benefits as well. So getting into nature, right, is important. Sleep is critical. Like, we have to go to bed like adults, and we have to go to bed by 9:30, 10:30 at the max. And
hell yeah, I can get behind that all day long.
Yeah, but people don't have good sleep habits if they're not exercising and eating well, right?
Yes.
So when people complain about sleep issues, I'm like, if you're not exercising or moving on the regular, I don't even want to hear about it. Like, you get moving first, and then we can talk about your sleep being disrupted. Because if you look at puppies or children, we all know the best way to get them to sleep well is to wear them out. So same goes for adults.
Exactly. I this has nothing to do with dermatology, but and I don't have a ton of training in it, but personally I find if I skip a week of working out, I feel like shit. And I just can't imagine how someone lives like that all the time if you don't exercise. Like, I sleep better, my appetite's stronger. When I don't work out, I'm sluggish, I have brain fog, I'm not hungry, I tend to reach for garbage foods. But when you're exercising, you crave healthy, nutritious things to fuel your body. And so it blows my mind that people have not come to that conclusion themselves, or with the amount of people who have been telling you this research exists, and they're like, oh, I can't sleep. Why can't I sleep? I feel tired. Why do I feel tired? It's like, the answer is right in front of you.
The answer is in the gym. I always say that. I'm like, just go to the gym.
Yes.
Stop talking, go to the gym. Have you been to the gym? No. Go to the gym, and then we can talk about that.
Are you depressed? Go to the gym. Are you happy? Go to the gym. Are you tired? Go to the gym. That's the answer.
Yes, yes. And then obviously fueling ourselves appropriately, eating nutrient-dense food. I don't really care how people eat. I don't care if people follow any specific diet. I just want people to eat a variety of good foods and eat nutrient-dense foods, because at the end of the day, food is information for our body and our microbiome in our gut. It needs variety. It needs interesting things to break down so it can do its job optimally. And we need diversity in our gut, which means we need diversity in our diet. So just eating eat like a grown-up, eat like your grandparents ate. This, I don't know why it's been so it's like turned into cults and polarized crazy people on the internet. And you say things one way and the carnivore cult comes for you, and you say things another way and the vegan cult comes for you. And I'm like, just eat real food, guys. Whatever floats your boat, but eat a variety of it. Don't starve yourself. Get enough protein. Although I actually think strength training and gym time is more important than the protein macros when it comes to muscle protein synthesis. So we have lots of data showing that protein alone can do pretty remarkable things for body composition, but I still don't think it's the magic panacea that allows you to skip out on the gym. So every time I talk to clients, they want to eat all the protein, but they don't want to go to the gym. And I'm like, no, I'd reverse that.
Yes, exactly.
Go to the gym. And then, like you said, Lindsey, you'll want to eat better foods. The gym fixes it. You want to hydrate more. You want to go to bed because you're tired. You want to eat better food because you want to support that muscle you just worked so hard to build. So I feel like the gym's the starting point. And I get messages from people all the time. They're like, I'm microdosing GLP-1s and I've lost 40 pounds. And I'm like, well, first off, I'm sure you're not microdosing. You're probably standard dosing. And number two, and they're like, now, and this is the worst. This is the part that makes my heart sink. Now I'm going to go to start strength training. And I'm like, no, you just lost 40 pounds and you did not start with strength. You have to start with strength training. So anyway, just doing all of the things like a grown-up is the way I see it. I live with a farmer in a long line of people who've lived on this land, and this man is the most commonsensical dude you'll ever meet. And he goes to bed at 9:30. He's like, it's bedtime. Stop talking. Why are you talking to me? Like, it's time for sleep. He eats when he eats. He gets out in the sun. He's out there all day, not necessarily in direct sunlight, but he spends a lot of time outdoors, keeps him very happy. And without that, he turns into a grumbly old man. So I think we just, we got to get out from under all the artificial lights all day. We got to move our buns around. We have to have good relationships. We have to mitigate our stress. We have to have community. Community's huge. Just having friends and mutual interest, having pets, having things you love. That's it. Like, that's the foundation. Everything works upon that. So if we're going to bring hormone replacement therapy in, you have to have all that dialed. Do your doctor a favor and get that dialed first. If we're going to bring in peptides like GLP-1s or any of the other peptides that are popular right now, none of those do a damn thing in a body that doesn't have a strong foundation built. Not for very long.
So that's what makes it so hard with allopathic medicine. People just want to come to you for a quick fix. And that's what I think that's a huge cause of like physician burnout, because it's like we're just perpetuating these chronic diseases, and it's so freaking frustrating. And yeah, so because I'm just thinking about like, so there's some promising studies, thinking from the derm side of GLP-1s in the setting of like psoriasis and hidradenitis suppurativa, which is great. And I'm like thinking, okay, but before we even get to prescribing that, like, we got to get these people in the gym. We got to get these people to eat right. And so it's just like, how do we find the balance? That might be a whole nother discussion, right? It's like,
let me chime in there, because I do have an opinion here. I think, and I get asked this a lot, I think that some people need a leg up. And GLP-1s definitely give people a leg up. It works on your dopaminergic pathways in your brain. And so it quiets down a lot of noise, and it gives people the gumption to go. And it also induces neuroplasticity. So it's a really cool window of opportunity. If they're on the GLP-1, they start implementing the lifestyle behaviors appropriately. They're going to hardwire those habits in. And I think that's a really cool opportunity if they take it.
Yeah. Okay. I like that.
A lot of people don't take it. Right. And then I won't write the prescription anymore. I'm like, no, sorry. You got it. Like, I'm pretty hardcore. Like, you got to do it my way, or we're not doing this, because.
Right.
But other people, I think there's a lot of people who are, and this is why I started microdosing it and talking about it out loud, because there's a lot of women like myself who are hitting perimenopause and menopause, and we are doing all the things right, like to a T, but we still have autoimmune disease. And we still have issues creeping up that are causing us duress. And so a little bit of a GLP-1 may, it's not for everyone, it may be a very helpful adjunctive addition. But it's not the end all be all. And I call it, excuse my French, I call it the ultimate fuck around and find out peptide, because you really can kind of, all of a sudden I'm like, I can tolerate gluten, and I can do all these things that usually inflame my immune system. And over time that impact wears off if you push it. And people can eat right through these, even if they are using them at high doses. And I've run into many people lately in the obesity community who are at the highest dose possible, and it's stopped working. So it's an opportunity for change. It's an opportunity for a leg up, but that patient or client has to want to make the changes.
That makes sense.
Yeah, I think too many people nowadays are just looking at it to be this magical like cure for obesity without putting in the work. But there definitely a 100% is some sort of genetic component to obesity. I mean, you just look at Oprah, right? Like, Oprah had everything in the world for her to help, all the resources, the money. She's tried every diet. She has the drive, and she still couldn't lose the weight. Like, obesity is an epidemic, but it is also a genetic component that some people truly need this medication to help. But then there are other people who just don't have the drive, and those are the kind of people that, I think Ozempic, you shouldn't just give it to them, because you have to learn how to put every piece to the puzzle if you want to be successful.
Well, it's part of a comprehensive treatment plan. And it requires hand-holding on the physician's part, and it requires resources on the physician's part to help these clients and these patients. So I would say having a health coach on board, having somebody to help them guide their nutrition, some kind of community and accountability program, making sure that there's a good referral to a gym in a way that folks can access it and afford it, right? That these pieces all have to be in place. And I have a course for practitioners that I allow the general public in, and I teach all of this, because I'm like, these are all important players in the game. We can't just give a peptide as monotherapy and hope for the best. It kind of reminds me, actually, speaking of your guys' profession, when I was a teenager, I remember going in with acne to the dermatologist and them just putting me on erythromycin for the rest of my life. Like, that's not the solution, right? I had some pretty substantial gut issues, et cetera. And I'm wondering, I don't know if that's still standard of care, but like, that caused me a whole litany of issues later. And I would say the same for anyone taking a GLP-1, even at microdoses. There was a study that I looked at in mice, and this was interesting. They took GLP-1, and I don't know, they didn't really clarify the dosage, but they took well-fed mice and they took brain slices. And so this was in vitro, and they took brain slices and they exposed these slices to GLP-1, and then the brain exhibited a kisspeptin boost. And so it signaled off kisspeptin, which is kind of like the master alarm for hormones. Like if you hit the kisspeptin button, the cascade, the hypothalamic gonadal axis will go to fruition. So you get hormone production, if you will. Then they took live mice who were undernourished and they gave them GLP-1, and the kisspeptin did not signal. Meaning, I'm going to just extrapolate, and this is a mouse study, not a human study, but I ponder if you're undernourished, if you're taking so much GLP-1 that you are malnourished and you are not consuming enough food, period, and you've put yourself into a semi-anorexic state, or your doctor has, and then you are wondering, like we're looking at middle-aged women here whose hormones are already falling out from underneath them. Like, what is that doing long-term? Like, that sounds like a potential disaster to me. So anyway, there's just a lot that can go wrong if you're not addressing all the things.
Yeah. Well, speaking of, you've been super vocal about bioidentical hormonal replacement therapy. What even is that? Like, tell us everything.
The way that I do it and the way I was taught to do it, which I have gotten a lot of pushback from the allopathic community on this, is I was taught to replace physiologic levels at whatever age. And so an example would be a 25-year-old male who is dealing with chronic migraines and has had multiple concussions from being a hockey player his whole life. And he's got no testosterone from all of the head trauma. So we give him a little bit of testosterone, the migraines dissipate, and he can lead a more normal and healthy and happy life, right? This might mean somebody who is dealing with chronic musculoskeletal pain, because my whole world's musculoskeletal pain, right? So my dosing goal is the pain being alleviated. That's my symptom pick. Like, I'm far more interested in symptoms than I am, especially in perimenopause, than I am in what the labs say. So maybe this person is subclinically hypothyroid. It's just very subtle. We give them a tiny little bit of thyroid and their symptoms abate and they feel much better and their labs remain normal. And so to me, that's just physiologic dosing. And I think that with HRT, I think it's really, honestly, I feel, my personal and professional opinion from what I've seen, I think it's really cruel to withhold something as safe as estrogen until we've waited a year after the woman stopped menstruating. I think it's just unnecessary. The changes, we have the literature now, the changes that are happening in the brain, everybody's different, right? Your brain may handle estrogen withdrawal no problem, whereas we know that the highest suicide rate group is middle-aged women. Women in middle age are killing themselves in droves, and I believe it's heavily due to the hormones dropping out. And so I think that adding in a little bit of whatever the hormone is that they need, and we're going to test and we're going to go with symptom picture to decide what that is. I think it's safe. I think the studies are bearing that out. We've even had a more recent study come out showing that estrogen is actually protective against breast cancer if used early enough. And so I think we have a window of opportunity. I think a whole generation of women got completely hosed by that women's health initiative.
Yes.
And
I know, so unfortunate.
And a whole generation of doctors, you know, I never stopped prescribing. I've been prescribing. I didn't know that doctors had stopped. I've been over there giving hormones for 20 years. Like, but safely. And I, again, at the very lowest doses necessary, like, let's get symptom relief to happen. That's the dose. Right. And that might be more or less for a different person, but it's a matter of just, it's kind of like an orchestra, if you will. It's just like GLP-1s, right? We've got all these signaling peptide hormones in the body that are controlling appetite and many other things, leptin, ghrelin, GIP, GLP, glucagon, insulin, all of those. And it's an orchestra. You can't just have any one cranked up and expect good things. So for instance, leptin and ghrelin, which are huge appetite signaling peptide hormones, they don't actually work well and they don't work appropriately in the body and with the vagus nerve if GLP-1 isn't adequate. If levels are not adequate, they won't actually, the receptor won't even bind and do its thing on the vagus nerve. So like, we kind of need the orchestra. And so I'm not a fan of this like movement that we're seeing online right now where everybody gets estrogen. It's like Oprah, like everybody gets estrogen. I don't think that's, I think if you put estrogen into an inflamed metabolically compromised body, you're looking at trouble. You're looking at, a clogged up liver and congestion, and you're looking at it going down pathways that are maybe not so favorable. And so it's really individualized, but I think that women do deserve better. And I think more doctors need to become at least, there needs to be a literacy level that needs to come back into the training on hormones at a base level, even just, at the GP level around the world, so that women can start accessing some of these. But they're not all tolerated well. They're not for everyone. And that's a conversation to have with your individual practitioner.
Why do you think that so many allopathic doctors are against it? A lot of women I've talked to, they have went to their GP and said, like, they won't test me for hormones. They said, I don't need it. I'm having all these symptoms. So why do you think people are against it, and how should women advocate for themselves?
Oh, that's such a good question. I don't know. I feel like there's a lot of women that are against it. There's a whole corner of Instagram that comes at me constantly of middle-aged and older women who just think we should be raw dogging menopause and nobody needs the hormone. Just get through it. It was hell for me. It's going to be hell for you. Get over it.
Yeah.
This is how nature intended. And I'm like, okay, but no, I will take my hormones. Thank you. I would like an easy ride.
I wonder if that the huge Women's Health Initiative study left such a bad taste in so many people's mouths, and made it such a stigma. And it's just the doctors aren't educated on the more recent, updates regarding hormone replacement therapy.
Well, and you guys know this, as licensed physicians, if we test for something, we're basically legally liable for what we find on those labs. And so we are in some ways responsible to treat it. And a lot of these doctors don't know how, right? That's endocrinology. That's a pretty in-depth learning curve. That's not like a weekend seminar. I mean, to learn to do hormones well took me years and years and years and years of training. And even I don't claim to be the expert. I'm just trying to help people, honestly, more often than not, just get to a place where they're pain-free. And then I will usually punt them to even a better hormone expert to say, here, go manage this. But if there's not pain involved, I don't tend to treat them with hormones. So I need them in an anabolic, healthful state so that they'll heal. So when I do a regenerative injection therapy, it will take. That to me is the only ethical way to do it. But there are people even more well-versed than I am. I just think that it's something that we have to educate ourselves as the patient, and then we have to learn to be diligent and learn to hunt and learn to seek out the care that we need. And so if the doctor that we're accustomed to going to, our primary care physician, is not going to help us, then we might have to go look elsewhere for that help. I have 3 or 4 different doctors, and they're all great, but they all have different skill sets. And I don't expect them all to be expert. I don't expect it. My husband's an electrician. He's not a plumber. He always says he's terrible at plumbing. But for some reason, because of the internet, everybody probably comes to you and expects you guys to be these hardcore functional medicine skin doctors, and they expect me to understand skin. And I'm like, this is not my wheelhouse. I think patients just need to learn to hunt, but it starts with them educating themselves. And we said something earlier, and I wanted to come back to it. I am actually so tired of people dogging on doctors and thinking that we're some kind of greedy, money grabbers when they won't do a damn thing to take care of themselves.
Right.
And they probably come into you and want their faces to look a certain way, but they don't even have any collagen integrity because they're in such poor health, So the onus of responsibility is on all of us as individuals. And I'm not trying to say that will fix everything, but we have to take care of our vessel if we want good outcomes from any of the treatments that we seek that the doctor is going to be providing.
Right. It's like they want our medical treatment, but they don't want our medical advice. They want to get better, but they come in and they don't like what they hear and they don't want to listen, which is super frustrating. But I want to ask you, though, we're talking about skin and we're talking about hormone replacement. What are your thoughts on topical estrogen?
Oh, yeah.
Do you like it?
I love it. I've been smearing it all over myself for years and years.
Really?
Yes. I learned a long time ago to use estriol in particular for the face and for the vagina, but estradiol works as well. It's just more potent. My thing is this movement right now we're seeing, I get it. You know, the way I was trained by my mentor was that the vagina and the rest of the body are somewhat separate, and that you can apply hormones vaginally. You can apply estrogen vaginally, and you'll get, I think it's such a wonderful, I think it's necessary. I think that a lot of women are dying unnecessarily because they were not given vaginal estrogen, and then they're ending up with chronic UTIs, and they're ending up with sepsis. It's a thing, and I've seen it in clinic, and it's horrible, and it's all solved with a little topical estrogen. But that said, that is absorbing into the body. And my mentors have told me, oh, no, it's separate. And I'm seeing on the internet, oh, no, it's separate. But we actually put products or medications onto the vaginal tissue in an attempt to get systemic absorption, because it is such a highly vascular region. It's like your mucosa of your mouth and your mucosa of your vagina are going to take in everything. So be careful what you put in there, right? Like the tampons that are full of glyphosate, for instance. Anyway, that said, I think that we should expect that there's a lot of systemic absorption when we're applying a topical hormone of any sort. And so while it might absorb differently here on the forearm than it would on the face, than it would on the neck, or it would on a more vascular area like your elbow pit or your knee pit or your groin or your vagina, I still think we're getting systemic absorption, and we need to, that conversation needs to happen, because I purposely give women topical estrogen, and when it doesn't, I'm sorry, testosterone as an example. And when I can't get serum levels up, I will tell them to put it on their vagina. When I treat women with micronized progesterone oral, the pills, and maybe they're starting to get some breast tenderness, or they're starting to get some symptoms that are, I think that the progesterone's not going down the right pathways, I'll tell her to insert it vaginally. So we know that we get systemic absorption with all of those hormones. So like, why would estrogen be any different?
Yeah. And I'm curious because, so like for topical estrogen, do you check serum? You said before you have them apply it vaginally, you will check serum levels of people who use topical estrogen, or were you talking about other hormones?
It depends. So if I have a perimenopausal woman, I care less about what her labs say, and I care more about her symptoms, because her labs are going to be all over the place anyway. That's the excuse a lot of doctors use when they say, I'm not going to test you because we don't need to because you're perimenopausal. They're going to be all over. They are going to be all over. So each month is different in a perimenopausal woman. Like, and we have to, that's why it's, the onus is on the patient to learn as much as they can, because one month they may be tolerating their hormones and the next month they're not tolerating them because they're perimenopausal, and some months their eggs drop and some months they don't. So there's that piece. But if we've got an older woman who's postmenopausal, I'm not as concerned. If she's having symptoms, systemic, like vasomotor symptoms, hot flashes, things like that, I definitely always want to test and make sure that we're staying in a safe range. But I still care about symptom relief, right? So whatever dose it takes to get to symptom relief. If we're talking topical for beauty on the face or vaginally for vaginal health, especially as they get older, I don't care as much. I just want to make sure that they're not getting UTIs chronically if they're using it vaginally. And so, but if they start getting symptomatic and they come in and they're like, I'm getting breast tenderness or I'm getting breakthrough bleeding, like, we got to be tracking that with labs and make sure that we're not overdosing them. Are they just absorbing it better? Everybody has a different absorption level.
Yeah, I'm curious because we were mentioning this earlier off camera, because that there were studies to show that you can get systemic absorption of estrogen when applied on the skin, and I'm curious to see if you also see that in patients too, like systemic symptoms. I've had actually, just like, here it is, it ties back into what you guys do in your industry. I've had women come in and all of a sudden their estrogen shoots off the charts on their labs, and I'm like, what are you doing? It turns out they've gotten some new cream that they got overseas in their travels, and it's chock full of estrogen. Oh, geez.
And so it's showing up in their labs, and I'm like, oh man, I mean, we're trying to hunt it down, because I know it's not what I'm prescribing them, because they've been steady on that, you know, and like, did they just have some magical absorption happen? But it's their beauty products. And so I think there's a lot going on there. So yes, of course. And they're just putting it on their face every night, and then their serum levels are shooting up. So of course it's being absorbed systemically.
And I think it's an important topic to just bring up, because I think there are practitioners out there saying that it's not causing systemic absorption, and I feel like it's making, for me as a derm, like, oh, okay, it's probably okay that I prescribe this person the estriol cream for her face. And I think it's important to just like for us to just have a little bit more caution before we just prescribe it to anyone or everyone.
I think estriol is just not as concerning of a estrogen as estradiol is, and so that's why I use that vaginally and for the face, because I'm not as concerned about systemic levels, because it's not as active of an estrogen. It's it's the kind of estrogen we make when we're pregnant. Actually, it's a kinder, gentler estrogen. We have estrone, which is the estrogen that our fat makes when we become postmenopausal, and that's a very inflammatory estrogen. We do not like estrone. Estrone is the estrogen I am very concerned about, but we know that estradiol can turn into estrone, and so that's where estriol, I think, is less concerning to me than giving the topical estradiol. It may be a little more expensive because it's compounded, but I do think it's safer. But all anyone needs to do is just go Google topical application of hormones absorbed systemically, and a bunch of studies will pop up. So, which makes me wonder, I mean, this is just a side note, but this is my thing. I was just talking to my husband about this. If we have that study that just came out showing that vaginal estradiol was safe in breast cancer patients, and that there was no increased risk. And I'm like, but it gets absorbed systemically. So would that mean that estradiol is potentially safe for breast? I'm not suggesting it is. And I know that there are people who are better versed at this than I am, and who are experts in this, and that's what they specialize in. But it just makes me wonder if estrogen really isn't it's not as much the villain as it's been made out to be, because I'm sure there's plenty of women who've had estrogen positive breast cancer who've been using topical estrogen on their vaginas, and it's not increasing recurrence rates. We need more studies on that, but it's just my thought process.
Okay. Well, I love, you have so much information to share. I love all these topics, and I don't know, I feel like you definitely have a lot of experience with so many different areas related to like women's health and longevity. We do have like some fun like rapid fire questions to ask you. Very curious to get your answers for these. Okay. So the first one is, what do you think is the best underrated supplement?
The best underrated supplement. I like astaxanthin. Have you heard about that?
Love astaxanthin.
Yes.
Okay. Yeah, of course you have. You guys are dermatology ladies. You know. Yeah, astaxanthin's great. So it's a fat soluble antioxidant. It tinges your skin the most beautiful color, and it's a natural, I won't say sunscreen, but it helps your skin handle the sun better, right? And helps with that UV oxidation and all that. And it's great for your mitochondria, so it's great for longevity as you're aging. I think it's a great supplement. That's my favorite.
Awesome.
Yeah.
Well, on the same note, I just like also rapid fire. What supplements are it, and what supplements are shit?
Oh.
So like, what supplements would you never recommend? And in addition to astaxanthin, like what else do you take every day?
I do love magnesium. And I think the form depends on what you're going for, but I do love magnesium. I love L-theanine. I love myo-inositol. I think myo-inositol is such a great, it's just kind of like the girlies BFF. It's good for your hormones. It's good for your metabolic health. It's just a nice, well-tolerated supplement. I do love fish oil. I'm a big fan. I know some people are very anti-fish oil, and I still don't understand why, but I think it's a wonderful one. I think vitamin D is fantastic. I do like getting some D from the sun, but I also do take it orally. I think vitamin K along with vitamin D is really nice.
Totally.
Gosh, I think, I kind of hate taking supplements. I spent a whole lifetime like studying them and giving them out, and I'm like, ugh. What else do I really, what's on my stack that I take every day? I'm not a huge fan of monotherapy or monostrain probiotics. I'm not a huge fan of like cranking a probiotic for long periods of time. That's just one or two strains. Cause I think your gut doesn't really act like that. That's not very naturally occurring. So I'm not a big fan of these like Acromancia forever to stimulate GLP-1 kind of thing that's happening right now. If you've seen those ads. I do think short term they can do some great things. So I do love a couple different probiotic strains here and there as needed, but that's a little more clinical. But yeah, I think that's probably it. I keep it pretty simple.
Love it.
Oh, what are shit? You asked me, what are shit?
Yeah.
Or overhyped maybe.
God, there's a lot of them that are overhyped. Is talking peptides, I think that BPC 157 is such a great oral peptide, by the way, for people who are like, oh, you have to be able to inject it. No, you don't. Taking it orally is so great for gut issues and leaky gut. I think that's a really beautiful one that I'll rotate in and out. But as far as some of the nonsense that I've seen out there, gosh, all over the place. There's some really hardcore anti-aging supplements that are way overpriced. And there's all this nonsense on TikTok with the young girls. There's a lot of young girls taking a lot of nonsense. And I don't even know what all it is. I guess the diet teas are off the table, but you guys have probably seen these too. Like these young girls taking, colostrum would be one of them.
Colostrum.
The marketing's been really good, but I'm like, no, there's too much going on. There's too much impact on your hormones, especially as a young woman taking colostrum, first of all. But so there's a lot of that happening that I think is a little scammy.
Yeah.
Yeah. And then I feel like collagen is like kind of all over the place. And it can be like kind of a controversial topic, definitely amongst derms.
Yeah.
I'm personally a fan, but I also think it depends on the type of collagen too.
Yeah.
I agree. Speaking of collagen, there's a supplement called HMB that's been added to some collagen products, and it makes them very expensive. I used to sell one in my line, but it was so cost prohibitive. But this HMB is, the promise of it is that it helps build muscle mass on its own. And that's very exciting, but it's very, very cost prohibitive, and it's you got to take some pretty heavy duty doses. So like that just doesn't fit into real life, you know? And then there's some senolytic products out there, some cellular senolytic products that I've even had sponsor my podcast, and I just have decided I don't know if they're worth. Very expensive. A lot of this. And so what I get is women messaging me saying, I'm on a fixed income and I can only buy one thing. And I'm debating between these three things. And I'm just like, oh gosh, those are also overpriced. You know, go to the gym.
Yeah, exactly.
Take some vitamin D and some magnesium.
Nice.
Anyway.
Okay. Well, you probably already answered this question, but what is one non-negotiable daily habit for metabolism?
Going outside, just
yeah.
setting your circadian rhythm. That
Love
will
it.
mess you up so bad because if you don't, I live in Oregon and there's some days where it is dark all day long and I don't know what time of day it is. And then my sleep is atrocious for days on end, which will completely screw up your metabolism. And I'm like, why is my sleep so horrible? Oh, it's because I don't know what time of day it is outside. And I didn't go outside for 3 days because it's been so horrible. So just getting outside like a mammal, like not a nocturnal mammal, just a daylight mammal that needs to see the sun and needs to see the sun set, and then go out midday, just for a few minutes midday, like get a little bit of sun on your skin, but let that, whatever that midday sun is doing, like let it set your clock throughout the day. I think that's a game changer. And when I talk to clients or patients, that's the one thing no one's doing. And I'm like, just please go outside and drink your coffee in the sun.
I know, I think that like derms, or I think people are taking a lot of advice to the extreme. Like a lot of people think derms are so anti-sun, but no, we're not. We just want you to sun responsibly. Like the sun is so important. Like you said, the circadian rhythm is so important for our hormones. And, we're not trying to demonize the sun as like, as dermatologists. We definitely see so much skin cancer. So maybe we're like biased in terms of how we give our advice. But yes, thank you. I think that having daylight exposure is important.
It's huge. I think we're going to find more and more that the reason we have so much type 2 diabetes in the world is because we have so many people with under artificial lights, blue light, and lack of outside light.
For sure.
Yeah. And I just had a basal cell carcinoma removed, and I have to go get Mohs surgery on my nose. So I hear you about responsitional sunning, which I didn't do for a long time.
You respect the sun because nobody is tougher than the sun, right?
Yeah. It's life-giving, but it's also, we don't want to melt our DNA under it. So
exactly. Got to have mad respect for it. But, well, anyway, Dr. Tyna, you have been absolutely incredible, and we have covered so much today. So if there were 3 actionable tips that you can give our listeners to support their metabolism today, 3 easy things, what would you tell them?
Go for a walk every day, particularly after meals, particularly if they've been heavy in carbohydrates. Go for a walk and bring your partner along with you or your children. You'll have a better family life if you do. It's a great time to connect and talk. take seriously that learning the skill of strength training is a necessary part of aging optimally. It's not negotiable. This is a non-negotiable here. It's not about vanity. It's not about being a musclehead. You have to figure out how to implement strength training in your life. And it is a skill, because I take care of people who end up bunging up their joints. So whatever you have to do to figure out that barrier to entry, have somebody help you learn the skill so that you have that, because it's something you can take with you forever. And then the last thing is go to sleep like an adult. Get off your phone, get off the TV, get off the blue lights, and put yourself to bed at a reasonable time. I have a rule: if my dog goes and puts himself to bed, it's time to go to bed. So
I love it.
that's it.
Yeah, go to sleep like babies and animals.
Yes,
And
exactly.
if you aren't doing those three things, you have no right touching a GLP-1, in my opinion. So I'll leave it at that.
Yes. Hallelujah. Okay. Well, where can listeners connect with your work? Where can they find you?
Everything's at drtyna.com. It's drtyna.com. And I have a podcast called The Dr. Tyna Show. I'm active on Instagram predominantly, and YouTube and TikTok. And then I have a free 4-part video series about GLP-1s, maybe the story they have not heard. And that's right on my website, right at the top at drtyna.com.
Awesome.
Amazing.
You have been absolutely incredible. We would love to have you back. And for everyone listening, I hope you learned something today. Thank you for tuning in. Next Tuesday, there will be an all new episode of Skin Deep MDs. Don't forget to subscribe, leave us a 5-star review, follow us on Spotify, Apple, and YouTube. Thank you guys for listening. We'll see you next week.
Thanks,
Bye.
y'all.